Hello, everyone. It is me again, Gordon Causey, aka also known as Gordy Canuck. That's my username on Twitter. Um, I'm going to talk to you today, this evening. It is now Tuesday, June 21st, 11:20 p.m. Eastern Standard Time, which is where I'm east of Toronto area, well east. Further the better. I like living in the country or in a rural setting. Wanted to talk tonight. I titled this something talking about monkeypox and about masks and about the potential for Thursday, on this coming Thursday, June 23rd. So less than 48 hours from now, we might have found out within 48 hours by Thursday evening. We will likely know whether or not the World Health Organization has declared monkeypox a public health emergency of international concern. They've scheduled an emergency meeting. A certain committee, I forget the name of the committee, that's holding this emergency meeting Thursday. And there are a number of items to be discussed, one of which is whether or not to declare monkeypox a public health emergency. And this has some precedence because it happened very recently. It happened on January 30th of 2020. I had to look that up. I knew that at some point that COVID had been declared a public health emergency, but I wasn't sure exactly what date. And as it turned out, that declaration was made on January 30th of 2020. And I imagine I wasn't aware, I wasn't paying attention when that declaration was made. I probably heard it, but I wasn't that concerned. All the media, all public health officials back then were saying not to worry, not to be overly concerned, is a quote I heard. Theresa Tam, who is Canada's Chief Medical Officer of Health, was in the press in January and February saying that Canada was well prepared to deal with anything that we had learned so much from the SARS, severe acute respiratory syndrome, outbreak that had happened in Canada, primarily in Toronto, back in 2003 or 2004. That everything's well in hand, relax. And I did. I was like, okay. I didn't take particular note of this declaration that COVID was a public health emergency, which is what the World Health Organization declared it all the way back on January 30th of 2020. Like most, the actual declaration of a pandemic came on March 11th. That was the date that COVID had been declared a pandemic. And of course, we all know it was in Canada, it was on March 17th or 18th, somewhere one of those 2 days when all the measures came out, when the 2 weeks to flatten the curve, when they extended March break for 2 weeks, and it ended up kids never went back to school the rest of the school year. And everything temporary became long-term. Instead of a short week, 2 weeks to flatten the curve, it stretched on for months. And I genuinely do believe that there is the potential for history to repeat itself. And one of the principal reasons why is that if a public health emergency of international concern is declared on Thursday, what that does is it mandates governments globally. Canada would certainly be involved. I'm certain the United States as well. One of the things it would mandate is widespread testing. when the public health emergency was declared on COVID, that was one of the first responses. Testing started taking place, ramping up through February and into March. And the thing is, doing some more reading, there have been other public health emergencies declared going back to 2007 a number of times. I believe swine flu, H1N1, and a couple of others, maybe Zika virus. They as well had that designation, but nothing happened. But there was a difference. Prior to COVID, there wasn't a PCR test, polymer chain reaction, I believe is what it stands for. There was no test to do. You could not test a wide swath of the population. This concern over asymptomatic transmission had never, you had no way to test to tell someone had an infection, but was healthy. So it was displaying zero symptoms of any virus. Now, in 2020, for the first time, with the recent invention of the PCR test, now they could test a wide swath of the population. And that's what they did. And as a result, as February rolled into March, the case numbers just kept building and building and building. And so on March 11, it was called the pandemic. And then on March 17th, 18th, lockdown, for lack of a better term, emergency measures, public health measures then superseded every other law that existed in a country like Canada. Freedom of assembly, freedom of religion, everything was gone because we're all going to die. 2 plus years later, cheers. Anyway, history very well could be repeating itself. We'll see if the public health emergency is declared. I am of the opinion that I will be very surprised if it is not declared an emergency. That's my opinion. I won't say that I'll fall off my chair. I'll be relieved if it's not. But I'm fully anticipating that declaration is going to be made. And then following that declaration, there is going to be public testing. I also know that there are people who will line up for the testing. People love being scared of viruses, and they'll want to know, and they will go to clinics, pop-up clinics to their doctor, however it plays out. They'll get a applicator rammed up. They'll get what I like to refer to as a nasal colonoscopy. And then I see the potential for the cases to go up, because now people who aren't sick, who aren't not showing any symptoms of illness, will now be counted. And as when COVID was declared a pandemic, it was not based on illnesses, it was based on cases. It was the number of cases warranted according to World Health. That's what warranted declaring COVID a pandemic. So first, public health emergency declared. Second step, lots of testing. Then if it follows the same pattern that happened with COVID, then lots of testing leads to lots of cases leads to declaration of a pandemic. And now there's a large segment of the population who believes that with the declaration of a pandemic, that this is what we do. This is how we respond, as we did with COVID. They'll be saying, well, we got to do something again. One area, I think, even with just the declaration of a public health emergency, is that people will start screaming. Not everyone, but a loud contingent of people will start screaming for a return to mandatory masking mandates. Just to give you an idea, in Ontario, Very few places now require a mask. Maybe some medical facilities, some, I don't even believe they're required to have them anymore, but they can if they wish. I understand some dentists are still mandating masks. And I wanted to read an article. This was published in the Canadian Broadcasting Corporation on their website. So it's not anything conspiratorial. It's right from that. You don't get any more mainstream than CBC. It's for people not in Canada. Anyone in Canada will know the CBC. If you're not in Canada, it's roughly the equivalent of the BBC or the British Broadcasting Corporation. And it's a government-funded media outlet. And they did an article on masking, and it was specific to the province of New Brunswick. And it said, as New Brunswick continues to reopen for business, the use of masks is being strongly recommended by government when physical distancing cannot be maintained. Dr. Jennifer Russell, New Brunswick's Chief Medical Officer of Health, said anyone who cannot keep an effective physical distance during COVID-19 should wear a mask. Some exceptions include children under 2 and people who can't wear a mask because of breathing difficulty. And people who can't wear a mask because of breathing troubles. But Dr. Colin Furness, an infection control epidemiologist and assistant professor at the University of Toronto, says wearing a mask can be dangerous. That is, if the wrong mask is worn, if it's worn incorrectly, or if people have incorrect expectations when wearing it. And then it quotes Dr. Furness as saying, the worst one is wearing one for too long, he said, noting masks can collect bacteria and other viruses. Furness said he wonders why this information isn't being shared when there is evidence about it. He said a study in a UK medical journal, the British Medical Journal, it doesn't say that in the article, I know the study he's referring to. He said a study in a UK medical journal showed healthcare workers who wore cloth masks all day while working were 13 times more likely to get a respiratory illness when compared to the standard practice of only wearing a mask when necessary. Those who wore a paper or procedure mask were twice as likely to get some type of respiratory infection if they wore it all day. The N95 masks were only worn when required during the study, and no staff were affected. This should not surprise us, Furness said. A mask, you're breathing on it all day long, creating all this wonderful space for bacteria to multiply. And once they get to a certain quantity, you start inhaling them. He said drug-resistant bacteria could be worse than COVID-19 for some people. Furness said he despairs at advice around use of masks, adding it makes people feel safe because they are doing it to protect themselves. I'm not anti-mask, he said, noting he is against the use without accompanying literacy. Furness said many think wearing a mask all day long makes the most sense to stay safe, but it's not. It's counterintuitive, and that can be harmful for people. Well, both the Public Health Agency of Canada and Russell began recommending last month that people wear masks. They urged that N95 and surgical masks be left for the healthcare community. The World Health Organization officially recommend the general public use masks as a way to reduce spread, only saying that if people decide to use masks, they should do so safely and properly. We encourage countries that are considering the use of masks for the general population to study their effectiveness so we can all learn from their experience, a spokesman for the World Health Organization said in a statement to CBC News. It goes back to Furness. Furness says, this is a little further down in the article, if a person has to wear a cloth mask, it should be made of heavy cotton fabric. The wearer should time how long they have it on. I only wear it for 2 hours total wearing time, Furness said. That's an arbitrary number Furness has chosen, but he said the published study indicates 4 hours is too long. He boils his masks after 2 hours of use. He said people should never wear masks outside or in the car. I'm wearing it only when I'm in an indoor place that's got lots of people. Grocery stores are high on my list because distancing is really hard when those aisles are narrow and everyone is a little bit tense. But Furness said people have to know they are wearing masks for the right reasons and not to get a false sense of security. And I'll leave you to read the rest of the article if you want. And I'm just reading. I linked it in the description to this video, so you're most welcome to go and read it. I'm not an infection control epidemiologist, virologist, or an immunologist, no degrees in infectious disease. So what I do is I defer to the experts. And in deferring to the experts, I listen to all the experts. I expect disagreement to happen. One thing I wanted to talk about was settled science. There's a lot of talk, and has been a lot of talk over the last 2 years. And you'll hear two contradictory statements from people. On the one hand, people will say the science is settled, irrespective of what they're talking about. And when they're expressing an opinion on something, they will say the science is settled on this. And then the same people who say the science is settled, when things change, will tell you, well, the science evolved. Well, those are contradictory. If the science of something is evolving, then it is not settled. I will give you some examples of science which is settled. The freezing point of H2O is settled. It's zero. It's zero today. It was zero yesterday. It was zero 100 years ago, 1,000 years ago. It'll be zero 10 years from now, 20 years from now, 20,000 years from now. Zero, that is settled science. It doesn't change. It doesn't evolve. Another example of settled science. And how did we find that? How did we find out that the freezing temperature of water, or H2O, is zero? Through experimentation and repeating the experiment over and over again. Replication. Because if something is true today, it has to be true tomorrow, next year, a year later, and every time in the future. That's why when they do clinical trials, confirmation in further clinical trials is always the best science, because mistakes can happen. Bias does creep into science. And so if one set of researchers show something through a clinical trial, and then it's confirmed by a second and a third and a fourth, that's eventually the science can become settled. I'll give you another example of settled science is the Earth's orbit around the sun. It takes 365 1/4 day. Hence the leap year. Actually, I believe it's 365 1/4 and a few seconds, but they adjust for the accumulation of seconds Every 4 years, world governing bodies readjust our clocks by a small fraction every few years to bring everything in line. In the same way that we add, an extra day to the calendar every 4 years to allow for the fact that the sun takes, or rather the earth takes 365 and a quarter days in its journey, its orbit around the sun, in one calendar year. That is settled science. That is settled. It's not like, it's not a guess. If someone says about anything that, well, based on what we know right now, but it could change because we don't know a lot. And when you're dealing with emerging viruses, novel viruses, when you're dealing with things that have never been tried before, like public masking mandates or lockdown measures, when you're dealing with things that have never been employed before, you cannot say the science is settled because there isn't enough data, there isn't enough evidence to make that statement. Things can change. And you can find out that the assumptions that you made previously were wrong. One famous, example would be at the start of this pandemic, there were some highly accredited academics, medical researchers, who were of the opinion that the SARS-CoV-2 virus could not have occurred organically, naturally in nature. There's one gentleman, a Nobel Prize winner by the name of Dr. Luc Montagnier, who passed away within the last few months. He was 89 years of age. But at the start of the pandemic, and I don't know exactly when, March or April, he did his research on the virus and said this has all the markings of a man-made manipulated, that this virus has been manipulated, that it's been engineered. That was declared misinformation. And you weren't allowed to say that. Dr. Montagnier, notwithstanding a Nobel Prize for his team discovered, or rather isolated, the virus HIV, human immunodeficiency virus, the virus which causes AIDS. His team was the first to isolate it and identify it categorically. And notwithstanding his reputation, which was stellar, his declaration that his opinion, his expert opinion, that the SARS-CoV-2 virus was created in a lab somewhere, that it was engineered. You were not allowed to say that for some insane reason, and he was censored, deplatformed, called a quack, and then later, several months later, I guess things evolved, and now there are many more experts who are now saying, okay, it looks like Dr. Montagnier was right. Sorry, we branded you a quack. And once they branded him a quack, branding is powerful, incredibly powerful. So anything he had to say after that, no one would listen to him. And he did have more to say, but his mic had been removed. He was still out there, but unfortunately, he was relegated to secondary platforms, being interviewed on obscure podcasts, things of that nature. So his voice didn't carry the way it was, the way it would have, the way it carried prior to SARS-CoV-2. He was a respected and highly sought after immunologist, or virologist, I believe is his specific designation. He specialized, past tense of the verb, he's passed on, in virology. So now, as things stand currently in my province of Ontario, Canada, masks are not, as I said, are not required pretty much anywhere anymore. A few odd locations, and I'll go back to wearing the mask I was wearing before all of this. I don't know if you've seen one of these. I don't know how well it shows up. It's got a white border on the end of it. It's just a flimsy little piece of plastic, like plexiglass, except it's, more pliable than plexiglass. Just a piece of clear plastic like you would get on a face shield. Well, this one secures here and here. And with our public health rules, their only requirement that they ever had was that any mask being worn, you have to wear a mask or a face covering. And the requirements were that it covered the nose and the mouth. Well, there, I covered my mouth and my nose. Because masks, proper masks, this is just to, comply. Real masks are medical PPE, personal protective equipment. But medical PPE, it's not the same as a pair of safety glasses that you put on. Medical PPE has to be sterile. This isn't sterile. When you pull a mask out of a pocket or out of your purse or hang it on your dashboard like a pair of fuzzy dice, that's not sterile. And you see all the time people who have actual medical and cloth masks on constantly touching it, and reference back to that article again about how they can be contaminated. I know that many will make the point that doctors, surgeons wear masks in the OR, and they do. And the reason isn't to stop a virus from spreading. They were never designed for that. The reason a doctor in an OR setting and other OR staff wear masks is because there's talking going on. And when you talk, yes, spittle or droplets happen. Only the difference is in an OR setting, you likely have someone lying on a table with an open gaping wound into their chest cavity. And you don't want to be having spittle fall into an open gaping wound. And the other reason, the secondary reason, or maybe this is the primary, I don't know. But the other reason is because in surgery, there can be bodily fluids can spray. And you don't want to be getting blood or some other type of bodily fluid spraying into your mouth. So it's a barrier. Though it's that's the same reason that dentists wear them. Dentists, when they're rinsing and doing all their stuff, there's spray coming back. They don't want to be sucking that in. They don't want that going directly into them. And so viruses will go in. Viruses are puny, an airborne virus. There's plenty of information out there. I mean, you can look it up. Look up how big is a viral aerosol, and then we talk about they talked about the 3 points of entry: eyes, nose, mouth. They say even before COVID came along, one of the biggest vectors of transmission that was believed to cause flu viruses, for example, to spread is that I've touched my nose. Right now, I go and I put my hand on the table. So I've got my, probably some little nasal secretion, mucus, whatever. Now I've touched the table. And then later, someone comes by and they put their hand on the table. And then they touch their eyes, touch their nose, touch their mouths. And these are things we do subconsciously without even being aware of it. Yeah. You see people do it all the time. Even people, I've seen people take their mask down to do it. They touch the outside of their mask, which can be contaminated with goodness knows what. I mean, SARS-CoV-2, bacteria, germs, or pathogens everywhere. So they've got this, warm, damp piece of cloth on their face, and they pull it down, and then they wipe their nose because it itches. And you want to laugh, you want to cry. But what are you going to do? I mean, what are you going to do? You don't want to be mean to people. I mean, I was at worship service on Sunday. This gentleman I know, and I like him. He's a super nice gentleman. And during the service, or I didn't see him during the service. I saw him afterwards. He was standing near the door, and he had a mask on. All right, fine. So you want to wear a mask? I don't care. But then later I saw him talking to another gentleman. And while they were talking, he took the mask off and stuffed it in his pocket. And then when he was after he finished the conversation with this individual, he pulled it out of his pocket and he put it back on his face. And I'm like, oh. But the world's gone crazy. I don't understand the motivation. I think part of it is that people want to appear like this shows that I care. Everyone's favorite words now, virtue signaling. We've turned into the Seinfeld episode where Kramer went on the AIDS walk because he wanted to support the effort to combat AIDS, but he didn't want to wear a ribbon. If you haven't seen it, you can look it up. Just look up Seinfeld Kramer ribbon. I'm sure YouTube has a video on it. It gets shared all over. If you're not old enough for Seinfeld, I think that was on in the 90s, so 20 plus years ago. Anyway, prattled on long enough. If anyone cares, I'm doing well. When this insanity started, I was still in the military, Canadian, and I retired from there in June of 2021. And for my own mental health, because these times have been challenging, I thought it was important to get back to work, get back to doing something. So I started working at a local business a month or so back. The thing I find surprising is that I would say of the people I see on a daily basis while I'm at work, the masking behavior, I'll put it at 50-50. 50% of the people wear masks, 50% don't. But interestingly enough, I notice, and this is just my own personal anecdotal observation, it's not age dependent. I see people who are clearly in their 70s, 80s, and I would say that the masking behavior among those 70 years of age and up, that it's 50-50. 50% wear masks, 50% don't. And it's the same, I'll say, for people 20 and up. Of the 20 and up crowd, say 20 to 30, say it's 50-50, 30 to 40, 50 to 50. 50% wear them, 50% don't. And see a lot more. The one thing I do notice now is that I do see a lot more people wearing what appear to be, I'm not going to go up and ask them, and I'm not going to test it, but they appear to be at least, the proper N95 or type. They look like a coffee filter. And for the most part, I notice a lot of people seem to have them fitted fairly tightly secured to their face. I mean, you still see, I have one. I'm going to get it. had a box of these given to me. I think I wore it twice. Most recent was at the dentist's office. But yeah, it's in cellophane. And you see these ones. And I just, the biggest thing you notice with these stupid things is quite often you see these big triangular gaps here. And 9 times out of 10, like me, they've got it below their nose anyway. But even if it's above the nose and pinched, yeah, you have massive gaps. I mean, what's the point? So, as I say, at least a lot of the people I see wearing them now, I'd say probably close to half of the people who do wear masks are wearing the N95 coffee filter type, and they look like they're over the nose. And I don't see them touching the outside material and adjusting them. And maybe those work, maybe. But anyway, God bless. Stay well. Thursday is coming. It's basically a day away now. It's almost midnight Eastern Standard. Not even sure where the World Health Organization meets. If it's in New York City, I'll assume it's Eastern Standard Time. So interesting times. And Thursday we'll see, and I'll likely do a video Thursday if a public health emergency of international concern is declared. If it's declared, I'll do a video that night. If it's not, I might do one again just to dodge the bullet. But again, I won't necessarily fall off my chair if they leave it alone. But I will be incredibly surprised, relieved, and very surprised. So I'll leave you with that. 37 minutes long. Talk to you later.